Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to begin a new series on alcoholism. Alcoholism is a very common problem in this country and worldwide. It's a serious psychological and medical problem as such. When I say alcoholism, I mean alcohol abuse. Worldwide, we now have 7.7 billion people in the world. 140 million people across the world use alcohol to one degree or another. Very, very, very common problem. What I intend to do after I do a couple of shows giving you the pros and cons of alcoholism, I will then go to organ to show you how multi-systemic alcohol really is. There isn't a single organ in the human body that alcoholism, i.e. alcohol abuse, does not affect to one degree or another negatively. So let's go a little bit about the statistics so this way you have an idea. As I mentioned, 140 million people drink alcohol to one degree or another across the world. 4 billion people drink alcohol adult in the world, but 140 million abuse alcohol, according to the World Health Organization. And there's no segment of society that's not affected with alcohol abuse to one degree or another. In this country, between 18 and 21 million people receive treatment for alcoholism to one degree or another. Pay attention, receiving treatment, meaning that many more millions abuse alcohol that's not getting treatment, that have not yet been identified alcohol abusers. And keep in mind that alcohol abuse itself is a genetically inherited problem. It runs in families. Because of that, if one knows that you have family members who abuse alcohol, then be careful not to, in fact, touch alcohol at all if you can avoid it to any degree, because it will be possible that you also may have the genetic abnormality in your DNA that can cause you to abuse alcohol. So once it's okay for people to take a glass or two of wine with their dinner and so on, and then they know when to stop. They just stop and that's it. However, people who have a genetic problem that leads to a psychological problem, once they touch the alcohol, they see it, they begin to drink it, they don't know when to stop. They cannot stop. So because of that, they get drunk. And the funny thing about it is that the amount of alcohol that can put people like you and me to sleep, if not in coma, yet these people can drink it and still functioning, talking to you, going to work and all that. And the alcohol level that they have in their bloodstream while they're at work will put people like you and me to sleep or in coma, but they get used to it. So you have to understand, let me give you a breakdown, a racial breakdown in this country of the different ethnic groups that are associated, and also men versus women that are associated with alcohol abuse. White female, believe it or not, 61% of white female abuse alcohol. 38.6% of black female. American Indian and Alaska Native, 38.6%. Asian, 30.1%. Native Hawaiian and other Pacific Islanders, 30.1%. Hispanic, 38.4% abuse alcohol. This is serious, serious, serious problem. All right? And that statistic came from the CDC. So, in other words, more white female, believe it or not, abuse alcohol than white males do, and more white male abuse alcohol than black male. It's an incredible fact, but these are the facts. And then 1 in 10 deaths that occur in working American in this country is associated to alcohol abuse to one degree or another. And this adds up to about 88,000 deaths per year, costing the system $222 billion. And the countries where alcohol abuse the most in the world are, I'll list them for you so that you have an idea. Luxembourg, Ireland, France, Hungary, Denmark, Czech Republic, Spain, Portugal, Austria, and Switzerland. These are the countries that the alcohol abuse is the highest. I have them listed for, and I have a graph and list of pages and pages of all the different countries that were alcohol abuse to the degree to which and all that in this chapter, which is chapter 91, that I actually copied from this big book that I wrote, The Art and Practice of Modern Clinical Medicine. So it is widespread. So it's a major problem. It affects all segment of society to one degree or another. There is no questions about it, okay? No question about it. So therefore then, one has to be very careful, very mindful of the fact that alcohol abuse can really do a lot of damage. Across the world, you have 3 million people per year die because of alcohol. And in this country, you have 1 on 20, worldwide, 1 on 20 deaths is related to alcoholism. And people who drink alcohol and drive, that is, while intoxicated, can lead thousands and thousands and thousands of deaths every year, people, because of car accident, because people should not touch alcohol if they know they're going to drive, because that's a very dangerous thing. Not only they're endangering themselves, but they're also endangering members of society. When they crash a car or whatever it is that they're driving, they can kill people. Not only that they can kill themselves, they can also kill people. Let me give you a little idea of the most commonly affected organs by alcohol. All organs are affected, but the most common ones, okay? The brain, the heart, the lungs, the liver, the spleen, the pancreas, the breast, the female genital organ, the male genital organ, and fertility in both men and women, the GI system, which is the stomach, all the way down to the small bowel and the large bowel for my mother, the blood system, the endocrine system, the mouth, the throat, the esophagus, on and on and on. All these different organs are affected by alcohol abuse to one degree or another. Okay, the neurological system, the psychological system, the skin, all these different organs are affected by the alcohol abuse to one degree or another. So you say, well, what is going on? How do these different organs get affected? Well, first of all, let's take out the brain. The brain is extremely involved in the entire psychological system. People get tied up with under stress, and they resort to drinking alcohol excessively. So that's the psychological thing that forces them to resort to the alcohol and drink it. Alcohol has done so much damage in terms of splitting families, people ignoring their wives and children and husband, etc., because they lose control of themselves, because they get tied up. Alcohol is a drug. There's no question about it. Alcohol itself is a drug, okay? When one drinks it socially, a glass of wine or one or two drinks per day, that's not going to hurt anyone. But when you abuse it, then that's the problem. The literature clearly shows that if one drink, let's say, red wine, or for that matter, white wine, moderately or in a small quantity, there are certain advantage to the cardiovascular system that you could benefit from that. Because what it is that the alcohol have stuff in it that works on the stickiness of the platelet, which is one of the blood we have in our bloodstream, that then prevent it from aggregating. Therefore, that then helps the cardiovascular system. In addition to that, there's stuff in the red wine that can also be healthy for the heart. I'm not encouraging people to drink, but I'm just telling you what the scientific facts are. Let's take example in France. In France, people drink wine starting at lunchtime because they have a couple of, I think it's a 2 hour break they have for lunch, I think, if I'm correct. So they go to have the lunch. In fact, they eat the biggest meal, as I think, if I remember the French culture, at lunchtime. So they have 2 hours. They take the time. They drink wine, and yet the incidence of cardiovascular system in France is much less than it is in other developed countries such as America, because there's certain aspect of the wine when it is not abused that can be helpful to the cardiovascular system. That's what the statistics shows, no question about that. So there is some advantage there. But the problem is not a glass or two of wine with dinner isn't the problem. Or when I get to talk about it, I will explain to you how much alcohol you have in certain drinks. I'll go over these. How much alcohol you have in beers, I'll go over these as well. But so that you understand, it is the quantity, not so much the quality. The quality has certain negative aspect of it as well when one drinks it in excess. But certainly, the quantity is the problem. And unfortunately, across the world, in developed countries and also in underdeveloped countries, alcohol is causing major, major, major damage. It's a serious drug, and it is unfortunately you don't need you don't need you could buy alcohol after, I believe, after age 21, whatever it is, without any problem. So therefore, people have access to it. In this country, you can't drink alcohol or buy alcohol unless, I believe, you're 18 or over. I want to make sure that that's probably it is. In some communities now trying to raise it to 21 or whatever. So it is a serious problem. And medically speaking, that thing can do a lot of damage to you when you abuse it. And then, as I said, I'm going to start talking from organ to organ so that you understand the damage that alcohol can do to the body as a whole. Let's take, for instance, the brain. Let's start there. I like to start from top down. I know the skin is first, but let's start with the brain first, because the brain is where the whole problem begins. The psychological problem, where the urge to drink occurs. The urge when you meet with your social friend, either in a bar or in a party after work, you want to be part of the group, so you drink and so on. Again, one or two drinks is not going to cause a problem. You shouldn't do that if you're going to drive. That goes without saying. Because some people, first of all, you have to understand women handle alcohol less well than do men. This is to say women get drunk quicker than men would. So you got to be very careful. And then when you have the psychological problem, because you have a predisposition to alcoholism, because this is something you inherited from from your parents, whatever, then when you under stress, you can't handle the stress and you grab alcohol. You resort to alcohol to ease the pain of the stress, and or it is basically not something you can help because you have a gene in you that is forcing you to abuse alcohol. As a clinician who practices general medicine as well, I have family members. If the father is an alcoholic, or the mother is an alcoholic, inevitably you wind up with children that are also alcoholics, and so on and so forth. And so this is serious business. So the psychological problem, the psychologists and the psychiatrists are better equipped to discuss this with you, but I'll tell you that's the behavior problem. Let's take a look at the organ, the brain itself. Many, many parts of the brain get damaged because of the effect of alcohol. On top of that, when people get drunk, they tend to fall down, they hit the head, or sometimes they get punched in the head, then they have problem with that. as I discuss this disease with you over the next several weeks, I'll get to the part where I will show you how alcoholic develop seizures. I have the list of the number type 1 through all the way to type 5 that tells you the different ways in which that people develop seizures because of alcoholism, alcohol abuse. I'll get to talk about that. But even before you get to the seizure part, you want to know that different part of the brain get affected by the toxicity of alcohol, because alcohol can be very toxic when drunk in excess. And of course, the brain is the first thing that get affected, because when you're drunk, your brain is not functioning properly. You can't stand properly. You can't think properly. You're stumbling all over the place. And so that's where the acute problem occurs. And then when people drink the alcohol chronically, then they get chronic damage in the brain. Sometimes they develop bleeding, subdural hematoma, peridural hematoma, or actually bleed inside the brain itself because of trauma. Either somebody punched them, or they fall down, they hit the head to a hard surface, and the brain get damaged that way. So the brain is crucial. Not only the brain is crucial in terms of behavior, that goes without saying, but the substance of the brain itself, the anatomy of the brain itself, get damaged by the toxicity of the alcohol itself. And then I'll be talking about alcoholic coma. I'll be talking about all that stuff. Don't worry about it. This is all, I'll be getting to all that stuff. But even before I get to that stuff, you have to understand the psychology that is into play. It's really the key problem here. What it is that caused someone to be able to take a drink of wine or two with dinner and then stop. Then what's going on? Why once you taste this stuff, then you can't stop. You have to keep drinking it. That's the psychological part of it. That's the genetic, hereditary part that's creating the problem. That leads to that many people, 140 million people, abuse alcohol across the world, and they are alcoholics. In this country, between 18 to 25 million people are receiving treatment for alcoholism/alcohol abuse. These are the people that are been diagnosed. Many more millions have not been diagnosed because they don't go for help. Or for one reason or another, they avoid help, or they can't afford the help, whatever the reason is. So these are the people who have been identified. And you could well imagine many more millions folks have not been identified. And there are several agencies/organizations in this country and across the world that are set up to provide help, psychological help, for people who have alcohol issues. And those agencies are doing a magnificent job in trying to step in for those who agree to get help on a constant basis. Once you join this organization, there is no getting out of it. You have to constantly go literally 5 days a week, if not more, as part of your group for you to join group with our colleagues so that you don't get involved with alcohol. I mean, this is a stressful world that we live in. Then you have to figure out what's the problem. Why is it that certain individuals are able to handle stress to one degree or another? Others resort to alcohol and other drugs, because alcohol is a drug, or other drugs, and then they become a drug addicts. They're dying all over the place now, all over the country. The death rate for opioid is extremely high. There's a big chapter in this book, and also in this book, African American Men's Health, that came out this past year on drug addiction as well. Serious, serious problem. And it is right now destroying certain segment of this country, and for that matter, across the world, these things are doing major damage. This is serious business. Okay, and the drugs all over the place that are being dumped on the different communities. And then once you get, the most important thing is not to get started. Once these people get started, it's very difficult for them to stop on their own without cold turkey, without getting help. And then you have to understand, because of the stigma that are associated with alcoholism, some people just don't want to deal with the stigma, so they keep drinking. Instead of seeking help, they're hiding it. And they wind up in the emergency room with problems when it is basically the damage is already done. It is amazing when I begin to describe to you the different organs, things that happen. I just talked to you about the brain. Well, let's take a look at another organ, the mouth. Well, the mouth gets damaged tremendously by the local toxicity of the alcohol, in particular for the people who smoke and drink at the same time. So there's a high incidence of oral cancer, throat cancer, because of alcohol abuse in conjunction with cigarette smoking and cigars and pipe or whatever, tobacco smoking, I should say. So you have a combination of those two things, and the incidence of throat cancer. There are other things that can cause throat cancer, but certainly you cannot be abusing alcohol without risking major damage to the mouth and the throat. Inevitably, those things are going to get damaged because the tissue was not made to be able to withstand the constant toxic damage that's being done to it by the alcohol. When I began to point out different drinks to you, I will explain to you the concentration of different drinks. You will see how much alcohol really is contained in these different drinks. Then you will understand why the toxicity is so high. And you have to understand the mouth and the throat, the part of the GI tract. Then if you go from the GI tract, you go down to the esophagus, because the food has to go through the esophagus to get into the stomach. But the esophagus gets damaged tremendously by the effect of alcohol, primarily by itself. We haven't even talking about what's going to happen to the esophagus after the liver is damaged. We didn't get there yet. We're just talking about the local irritation because of the concentration of the toxicity of the alcohol going down the esophagus. Because when you drink it, it has to go through your throat down there. Well, if you drink too much of it, or what you're drinking is too rich in alcohol, then it's going to damage that tube called the esophagus. So therefore, you have esophagitis, and you could start bleeding from the esophagus because of the local damage that's occurring to it constantly because of the effect of the alcohol that's going through it constantly. Okay? Then when you get down to the part of the esophagus that's going to enter into the stomach, well, the stomach gets pretty beat up as well, because the alcohol has to go to the stomach, then find its way toward the liver, so the stomach itself gets beat up, and then you have with high incidence of bleeding ulcers because of the local irritation of the alcohol into the stomach. And then when you get through that, then there's another organ that I'll be talking about. Of course, this is the pancreas. Oh my goodness, the pancreas get beat up so bad with alcohol. So you get both acute pancreatitis and chronic pancreatitis. And then this is a common, constant problem. We're admitting problem. I've been bringing people to the hospital because of the toxicity of the alcohol to the pancreas, damaging it. The pancreas become acutely swollen and painful. People start vomiting, and there's a whole way to manage acute pancreatitis secondary to alcohol abuse, and then eventually the pancreas develop what's called chronic pancreatitis. And because of the chronic pancreatitis, then you got all sorts of other problems because the particular enzyme that are needed in order for us to digest our food cannot be produced by the pancreas because it's damaged. So therefore, then the food go right through you. You got diarrhea, malabsorption, severe abdominal pain, and recurrent pancreatitis. There are many things that can cause pancreatitis. I'm talking about alcohol itself. That's one of the major problems of alcohol abuse is pancreatitis. Then it wind up being complicated with all sorts of stuff, all sorts of crazy stuff. You can develop type 2 diabetes because of that. Then there's a higher incidence of cancer of the pancreas because of alcohol abuse. Because whenever you have an inflammation, the DNA get damaged, then you start having problem. Then the next thing you know, you develop a cancer. There are a lot of things that can cause cancer of the pancreas without alcohol. A lot of people, unfortunately, develop without having anything to do with alcoholism. But I'm specifically talking about alcoholism. All that increases all cancer of the esophagus, cancer of the stomach, cancer of the pancreas, all these things, cancer of the throat, as I mentioned before, all this increase because of the irritation that the alcohol causes and the damage it causes to the DNA, causing dysplasia. Once you have dysplasia, dysplasia is the first step, and the DNA becoming damaged even more. And then you develop type 2 diabetes because once you have chronic pancreatitis, the part of the pancreas where insulin is made is being affected. So that's another form of type 2 diabetes, is chronic pancreatitis. So, I mean, alcoholism is a serious, serious, serious problem. There's nothing to ignore. Do all that you can to avoid abusing alcohol because then it controls your life. No matter how talented you are, no matter what it is that you do for a living, you could be the most brilliant person in the world. Alcohol will eventually destroy you because of that. And your talent will never be able to put in play to help society. It's not going to work. So all you could do all that you can to avoid abusing alcohol. I'm not here pontificating. A couple of glasses of wine with dinner, a couple of drink, even hot drink here and there, it's fine. But if you know you have predisposition because of a family member who have it, stay away from it. Listen, I'm going to stop here. Next week, I'll continue to talk about alcoholism. We got weeks to go until this series is over. Until such time, keep watching this show. This is Dr. Alcena saying so long and bye-bye.